Hello everyone, you are watching Medico's Guide, and in this video we are going to discuss about descending tracts. So first thing first, we have three different terminologies to discuss prior to moving on to descending tracts, and these three terminologies are lower motor neuron, descending tracts, and upper motor neuron. So let's discuss them in a reverse order. So first we have lower motor neuron, and basically, as you know, that in spinal cord in anterior gray column there are motor neurons, and these motor neurons, they give rise to axons that travel in anterior route and then the innervator muscles. So basically, this pathway, it forms a final common pathway to the skeletal muscles. Then we have descending tracts. So as you know, that lower motor neuron, they get influences from the higher cortical centers and from all the different supraspinal regions. For example, the cerebral cortex, from the brainstem, as well as from the sensory fibers that are coming along the sensory root. So when all of these fibers, they descend down the spinal cord in the white column or the white matter, so they segregate themselves into nerve bundles, and these nerve bundles, they are referred to as descending tracts. Now the upper motor neuron. So basically, the upper motor neuron are all the supraspinal nerve cells, nerve tracts. So these are all referred to as upper motor neurons. Now let's talk about anatomical organization. So as you know that our higher cerebral cortex, it is responsible for controlling or regulating our skeletal muscle activity. So it is by the series of neurons. And these series of neurons are basically three in number in the descending tracts, just as they are in the ascending tracts. But of course, there are some differences in the location of the cell bodies. So these three neurons, they are first order neuron, second order neuron, and the third order neuron. So in the first order neuron, what we see is that this is the upper motor neuron and its cell body is located in cerebral cortex. Then it gives rise to axons, and these axons, they terminate by synapsing on second order neuron. Now the second order neuron is known as internuncial neuron, and its cell body is located in anterior gray column of spinal cord. And now the fibers or the axons that are originated from these neurons, they are short and they terminate by synapsing on the third order neuron. So now the third order neuron, it is known as lower motor neuron, and its cell body is located in anterior gray column of spinal cord. And this neuron, it gives rise to axons that directly innervate the skeletal muscles through the anterior root and spinal nerve. Now let's talk about the classification of descending pathways. So we broadly classify the descending tracts into two tracts, that are pyramidal tract and the extrapyramidal tract. Now in the pyramidal tract there are two pathways, and these are corticospinal tract and the corticobulbar tract. And we further divide corticospinal tract into two tracts, that is anterior corticospinal tract and the lateral corticospinal tract. Now let's talk about the extrapyramidal tract. So basically there are four major tracts, while the fifth one, that is the olivospinal tract, so its existence as a separate pathway is still doubtful. So the four that are remaining, and these are reticulospinal, tectospinal, rubrospinal, and the vestibulospinal tracts. Now let's see what are the functions of descending tracts. So the first pathway is corticospinal tract. So now the corticospinal tracts, they are responsible for voluntary, discrete, and skilled movements, especially of the distal parts of extremities, for example of the hands. Then we have reticulospinal tract, and this is responsible for either it can facilitate or inhibit the voluntary movement and reflex activity by inhibiting and facilitating the alpha and gamma motor neurons. Now tectospinal tract. So for example, whenever we receive the visual stimuli, what happens is that our head and our whole body tends to rotate in the direction of the visual stimulus. So this function is basically controlled by this tract, that is a tectospinal tract. As well as if there is darkness around, the fibers that are responsible for the sympathetic, that are associated with the sympathetic neurons, so what they do is the pupillodilatation. So this is also a function of the tectospinal tracts. Now rubrospinal tract. So rubrospinal tract can facilitate the flexors while it inhibits the extensors or the anti-gravity muscles. So it means that this pathway has no relation with our balance. Now vestibulospinal. So now the vestibulospinal tracts, they work exactly opposite to the rubrospinal tract, in that they facilitate our extensors, that is anti-gravity muscles, while they inhibit our flexor muscles. So it means that they play a role in our balance. Now the olivospinal tract. So these pathways they play the role in muscular activity, but as you know that their existence as separate pathways is still doubtful. Now descending autonomic fibers. So these fibers they are responsible for controlling our sympathetic and parasympathetic activities. So it means that they are basically controlling our visceral activity. Now let's talk about the differences between the pyramidal tracts and the extrapyramidal tracts. So the pyramidal tracts first, and their origin is from the cerebral cortex. And these tracts they are responsible for rapid and skilled voluntary movements. While the extrapyramidal tracts they arise from the brainstem, and then they carry the fibers and they terminate in the spinal cord. And these pathways they are responsible for simple and basic voluntary movement, as well as they also control autonomic control of the muscles. So, for example, the muscle tone, balance, posture, as well as locomotion. Now, this is the transverse section of the spinal cord, and it is basically showing the termination of all the descending tracts. Now, let's talk about the root of these all tracts, and the first one we are going to discuss is about the pyramidal tracts. So now the first tract that comes in here is the corticospinal tract. So now first talk about its origin. So as you know that in the fifth layer of the cerebral cortex there are pyramidal cells, and these pyramidal cells they give rise to axons, and now these axons they are basically different in proportion, and they are coming from the different areas of the cerebral cortex. So this proportion is basically that two-thirds of the fibers they are coming from precentral gyrus, while the one-third fibers are arising from postcentral gyrus. Now the two-third fibers that are coming from the precentral gyrus, they are further divided into two. It means that they are coming from the two different regions, and the one-third is basically coming from the primary motor cortex, while the other one-third is coming from the secondary motor cortex. So this is how the fibers are coming from different regions. And yes, it is very much interesting to know that majority of the corticospinal fibers they are myelinated. They are slow conducting and they are slow fibers and small fibers. Now, before discussing the whole pathway, we should know what is homunculus. So, whenever we stimulate different parts of the precentral gyrus, what we see is that there is stimulation of the different parts of a body on opposite side. So it means that our whole body is represented on the cerebral cortex, and it is basically in a distorted form. And this distorted picture is known as homunculus, that is represented on the cerebral cortex. Now, why am I calling it a distorted picture? So the reason is twofold. First is that as you can see in this diagram, that our face is located inferiorly, while our legs are situated medially and superiorly. So this is basically a distorted picture. And the second reason for it calling a distorted picture is that here you can see that the size of the body regions is not according to the physical size. So rather it is according to the skillful and the precision movements that are performed by that body regions. So as you can see here that the skin and the face and the hand muscles they are occupying a larger area, while the thigh muscles are occupying a very small area. Now here these are the transverse sections of the different you can see the areas of the brain. So first you can see that the midbrain, and the other one is the parts of the internal capsule. So now let's know that what are the parts of it, and basically they're gonna help you out in understanding the pathways or the roots of the tracks. So these are the important things that are part of internal capsule, you should know them. So what are they? They are basically four in number. There are four parts. So first is anterior limb, then we have the genu, then posterior limb, and then we have the retrolentiform part. Now let's talk about the transverse section of the midbrain. So the first part that is most posteriorly located, in which there are inferior the superior colliculi. So that part is known as tectum, while the middle part, or you can say the part that is present posteriorly to the substantia nigra, so that part is referred to as tegmentum, while the area that is anterior to the substantia nigra is referred to as crus cerebri. And yes, we further divide the crus cerebri into three parts. And the first part that is located most medially, that is known as medial part. Yeah, medial or the medial section. Then the part that is in the middle is known as middle section, while the part that is located laterally is referred to as lateral section. And remember that the pathways that are corticospinal tracts and the corticobulbar tracts, they pass through the middle section of the crus cerebri. Now let's talk about the whole root of corticospinal tract. So as we have already discussed about the origin of the corticospinal tract, so let's move ahead. What happens is that when they have arisen from the fifth layer of the cerebral cortex from the pyramidal cells, so all of them converge into corona radiata and then they pass through the posterior limb of internal capsule. Now when they descend through the brainstem, some special and important events take place. So you should remember them. First, in a midbrain, they pass through middle 3/5 of crus cerebri. Now, as they're passing through the pons, what happens is that this whole corticospinal tract is broken down into so many different bundles, and it is by the transverse pontocerebellar fibers. Now, when they're passing through medulla, what happens is that all of these fibers or the nerve bundles, they are again grouped together and they form swelling on the anterior part of medulla, and this is known as pyramids. Now, majority of the fibers, that is 80% of the fibers, they cross to the opposite side and then they travel in the lateral wide column as lateral corticospinal tract. And then let's talk about the remaining tracts, that is 20% of the fibers that didn't cross at the level of the pyramids. What happens is that they continue to travel in the anterior wide column as anterior corticospinal tract, and then they descend, and then what happens is that eventually they do cross, and they cross at the level of their destination as they reach in the cervical and upper thoracic regions. Now let's talk about their termination. So majority of the corticospinal fibers, they terminate by synapsing on internuncial neurons, while only the larger ones, they terminate directly on the anterior motor neuron, and that's why they are responsible for the skillful activities that are taken place by our hand muscles. Now let's talk about the branches that are given off by the corticospinal tracts, and these branches that are given off by them is at the two different levels, and these levels are the cortical level and at the subcortical level. Now what happens is that at the cortical level, these fibers, these branches, they return to the cortex and then they are responsible for inhibiting adjacent cortical activity. While at the subcortical level, they are responsible for keeping the subcortical regions informed about the activities that are taking place in the cortex, so that these regions, they can also modify the alpha and gamma motor neurons accordingly. Now let's talk about the corticobulbar tract or the corticonuclear tracts. So basically these tracts, they have the same origin as that of the corticospinal tracts. So now let's talk about the root. So first, these fibers, after they have risen from their area, so all of these fibers, they then converge into corona radiata and then they pass through the genu of the internal capsule. Now as they are descending through the brainstem, they terminate there by synapsing on various cranial nerve nuclei. So basically, they provide innervation to all of the nuclei, cranial nerve nuclei, starting from the 5th to 12th, but excluding the two, and these two exceptions are the vestibulocochlear nerve and the abducens nerve. So it means that they are responsible for the voluntary movement of the head, of the face, and of the neck. Because you know that these cranial nerves, they are controlling what? The trigeminal nerve is controlling our muscles of mastication. Facial is controlling our muscles of facial expression. Glossopharyngeal is controlling our pharynx. Then the vagus nerve is controlling our larynx. Then accessory are controlling our SCM muscle, trapezius muscle, and the hypoglossal is controlling our tongue. So all of these are the muscles of our face, head, and neck. Now the important point regarding this tract is that it provides the bilateral innervation to all of these nuclei, but the exception is that it provides only the contralateral innervation to the lower facial nucleus. That is why we can see that whenever there is upper motor neuron lesion, so only the contralateral lower side of the face is affected. And also it provides the contralateral innervation to the hypoglossal nucleus. Now let's talk about the extrapyramidal tracts. So as I've already told you that there are 4 tracts in total in the extrapyramidal tracts, as you know that the existence of the olivospinal tract as separate pathway is not known or it is still doubtful. So now the four extrapyramidal tracts are: number one, vestibulospinal and the reticulospinal. They are paired together because of their same thing in that they do not decussate, so it means that they provide the ipsilateral innervation. While the rubrospinal and the tectospinal they do decussate, so it means that they provide the contralateral innervation to our muscles. Now our first pathway in the extrapyramidal tract is reticulospinal tract. So now let's try to figure out what is the root of this tract on the basis of its name. So the reticulo means that it arises from the reticular formation, while spinal means that it terminates in spinal cord. So now first of all we should know what is reticular formation. It is basically a group of scattered nerve cells and nerve tracts that are existing throughout our brainstem. So now first tract is a pontine reticulospinal tract. So what happens is that in the reticular formation of the pons, these reticular formation they give rise to axons and then they travel in anterior wide column of the spinal cord and then they terminate there. And majority of these fibers they are uncrossed. Now the medullary reticulospinal tract. So here basically the reticular formation of the medulla it gives rise to axons and then they travel in the lateral wide column and then they terminate in the spinal cord. Now these fibers they can be crossed or they can be uncrossed. Now these pathways, as I have already told you, that they are responsible for facilitating or they can inhibit the alpha and gamma motor neurons. So in turn they can facilitate or inhibit our voluntary movements and reflex activity. Now, it is important thing about the reticulospinal tract, and this thing is that this pathway also thought to constitute the descending autonomic fibers. So, it is thought that hypothalamus uses this pathway to control sympathetic and parasympathetic outflow. Now let's talk about tectospinal tracts. So the word tecto means the tectum of the midbrain. So it means that this pathway arises from superior colliculus of the midbrain. And then the spinal shows that it terminates in the spinal cord. So now let's talk about its root. So as you can see in the figure that it arises from the superior colliculus and superior colliculus is related with the visual reflex. Now, when they arise from the superior colliculus, soon after they cross the midline, and then they descend through the brainstem just close to the medial longitudinal fasciculus. And now, when they're descending through the spinal cord, they basically travel in the anterior wide column of the spinal cord, and then they terminate in upper cervical segments by synapsing on internuncial neurons. And now as it is arising from superior colliculus which has relation with visual reflex, so you can remember that this pathway is responsible for the reflex postural movements in response to visual stimuli. Okay, now we have rubrospinal tract, and the word rubro means red nucleus, so it means it arises from red nucleus, then it ends in spinal cord. Now, the red nucleus is basically situated in the tegmentum of the midbrain at the level of superior colliculus. So now after it arises from the red nucleus, it immediately crosses the midline and then it travels through the brainstem, and then as it is descending down the spinal cord, it travels in lateral wide column of spinal cord. And now let's talk about its termination. So it terminates in anterior gray column by synapsing with internuncial neurons. Now the important thing regarding this tract is that it receives afferent from the two different regions, and these are cerebral cortex and cerebellum. So both of these regions they uses this important indirect pathway to control the alpha and gamma motor neuron activity. And as we have already discussed that this pathway is responsible for facilitating or you can say activating our flexor muscles while they inhibit our extensors or the anti-gravity muscles. So is this pathway related with the balance? So the answer is no. Now let's talk about vestibulospinal tract. So now vestibulo means vestibular nuclei and it shows that it arises from the vestibular nuclei that are present in the pons and medulla. Now, what happens is that when they arise from the pons and medulla beneath the floor of the fourth ventricle, before descending, they receive afferents from inner ear through the vestibular nerve and from the cerebellum. Now, this tract descends uncrossed through medulla and through the length of spinal cord in anterior wide column, and then they terminate by synapsing with internuncial neurons. Now let's talk about the function of this tract. First, as you know, that they receive afferents from the inner ear and from the cerebellum, so it means that by this tract, they basically facilitate the activity of extensor muscles and they inhibit the activity of the flexor muscles, so it means that they are playing the role in our balance. And their also important role is that they maintain head and eye coordination, upright posture, balance, conscious realization of spatial orientation and motion. Now, as we are going to discuss about two important vestibular spinal tracts, so we should know what are the different types of vestibular nuclei. So basically, the vestibular nuclei, they are four in number, and these are lateral vestibular nucleus, medial vestibular nucleus, superior vestibular nucleus, and the last one is descending, or you can call it as inferior vestibular nucleus. Now let's talk about the two different vestibular spinal tracts, and these are medial and the lateral vestibular spinal tracts. So now let's discuss the differences between the two. So first, the medial vestibular spinal tract is responsible for supplying the muscles of the head and neck, while the lateral one supplies the muscles located in other parts of the body. So when there is a movement of the head, signals are sent by these vestibular tracts to the specific anti-gravity muscles. And also, there are some other differences that in the medial vestibular nuclei, so the fibers they descend in anteromedial aspect of the spinal cord and then they synapse on the medial ventral horn neurons. Now, the lateral one travels in the lateral column of the spinal cord and then they synapse on more laterally located motor neurons in the ventral horn of the spinal cord. Now here we have the column of differences between the two. So in the medial vestibular spinal tract, it arises from medial and inferior vestibular nuclei and then it descends bilaterally in the medial longitudinal fasciculus. Then a synapses with excitatory and inhibitory neurons of cervical spine. So basically it innervates the interneurons in the cervical and upper thoracic spine. Now the lateral vestibular spinal tract, so it arises from the lateral vestibular nucleus within the brainstem, and then these fibers they descend ipsilaterally through the anterior funiculus of the same side of the spinal cord, and then they synapse on extensor anti-gravity motor neurons. Now let's talk about the functions of vestibular spinal tract in a bit detail. So the first function is upright posture maintenance. So basically this is performed by both the medial and lateral vestibular spinal tracts. And the medial tract supplies the muscles of head and neck, whereas the lateral tract supplies the muscles that are located in other parts of body. When the head of the person moves, so signals are sent by these vestibular tract to specific anti-gravity muscles. These muscles contract and maintain the upright posture of a body. Other functions are vestibulospinal reflex, and basically it uses the organs of the vestibular system and skeletal muscles so that it can maintain a balance and posture. The next is head and eye coordination. So basically this performs the synchronization of the movements of the eyes with the movement of the head so that the eyes do not lag behind when the head moves to one side, and this function is very important for maintaining the balance of a body. Then we have head riding reflexes, and these are responsible for keeping our head and gaze horizontal. Then the next one is eye riding reflex, which is also known as VOR, which is vestibulo-ocular reflex. So basically this originates in ascending medial longitudinal fasciculus and then it extends to the extraocular muscles of the eye. So the horizontal position of the eyes when the head is in an upright postural set, it is caused by cancelling of the tonic activity of the deteroocular pathways, and therefore it is responsible to keep the eyes still when the head moves. So enable us to focus the image on retina. Now here you can see that the head and eye coordination and vestibulo-colic reflex, which is VCR, so they are controlled by medial vestibulospinal tract. Now here's a little detail of the VCR. So what happens that when our neck muscles detect posture sway, so in order to maintain the balance, the sensory impulses they travel through the 8th cranial nerve, that is vestibulocochlear nerve, and then the motor signals are transferred to cervical spine nerves to maintain the upright head. Now here there is a little detail about the VOR. So as you know that the oculomotor, trochlear and adducens, they all are efferent nerves in this VOR. And now what happens is that when the head is turned left, so both of the semicircular canals, they are rotated in the opposite rotation direction. And then they are going to trigger the eye muscles to move in opposite rotational direction. For example, when there is right cervical rotation, so the lateral rectors of the left side is activated while the medial rectors of the right side is inhibited, and vice versa in the opposite case. Now, the lateral vestibular spinal tract is responsible for the VSI, which is a vestibular spine reflex, and this reflex basically allows maintenance of a balance when the postural sway is detected through movement of the trunk, arms, and legs. So, what it's going to do, it's going to send the sensory innervation through the vestibulocochlear nerve, and then the motor is sent to the thoracic and lumbar spinal nerves, and this basically helps initiating a hip or step strategy to maintain a balance. Now, the next and the last one is olivospinal tract, and basically, it is thought to arise from inferior olivary nucleus, and then it descends in the lateral right column of spinal cord. So, the function of it is that it influences the activity of motor neurons in anterior gray column, but there is considerable doubt that it exists. And also another function of it is that it conveys information from cutaneous and proprioceptive organs, and it is involved in the control of movements of body and limbs. Now let's talk brief about the lesions of the descending tracts. So in the pyramidal, it may be damaged at any point along the spinal cord, and internal capsule is often involved in the hemorrhage and stroke. Now the deficits are mostly contralateral, and the typical manifestations of the upper motor neuron injury are increased muscle tone, hyperreflexia, weakness, clonus. Babinski sign is positive, that is the upward movement of the big toe on stimulation. Then the Hoffman sign is also positive, in which there is basically flexion and adduction of the thumb and flexion of the index finger when you flick your thumb with the nail of subject's middle finger. Now, the extrapyramidal tract's typical manifestations are Parkinsonism, in which there is rigidity, bradykinesia, tremors, postural deficits. Then, chorea can be seen, athetosis, and there is dystonia. Now, that's all about today's video. Thank you for being a part of our YouTube community. Your support, comments, and engagement have made this channel truly special. As we wrap up this video, we want to express our deepest gratitude. It's been an incredible journey and we appreciate each and every one of you. While this may be the end of this adventure, we hope our paths cross again in the future. If you enjoyed the content, don't forget to hit the like button, share it with your friends, and subscribe for more. Thanks for watching.